Our next speaker works at the intersection of healthcare, technology, and access, focusing on how cycles of trust can make or break a healthcare system, specifically for pregnant women. I'm so happy to share also that she is experiencing a full circle moment of her own. Not so very long ago, in 2011, she was on the organizing committee of TEDx Delft and is joining us today as a speaker. Her talk is titled 260,000 Reasons to Build Trust. Please welcome Julie Fleischer.
I am a mom. I am very lucky that I can stand here today and tell you that. In 2023, 260,000 women died as a consequence of being pregnant. 6 more women will have died by the time I finish speaking. Over 90% of these women live in low and middle income countries, mostly Africa and Asia. But 95% of all these global deaths could have been prevented with the medical knowledge and care that are available in other parts of the world. 95%, that's 247,000 women. So I wonder, how does this number, this insight, make you feel? I get really angry. We know how to prevent this, and yet this still happens. It's frustrating. But it's also motivating. We know how to prevent this. So I want to help and fix it. I am not a doctor, I'm not a midwife. I'm a mechanical engineer and designer by training. And I started my career building medical devices for maternal health. And I quickly realized it's not just about these tools, it's about the system around them that's broken. And that's what led me to Farm Access, founded by Professor Joep Lange, who once said, if we can get a cold Coca-Cola and a beer to every remote town in Africa, it should not be impossible to do the same with drugs. And as it turns out, he was right. He did it. He helped to bring life-saving HIV medication to thousands and thousands, millions of people across the globe. And it's that same conviction that we continue to apply to maternal health today. So why do so many women die? If you ask that question in the global health community, you're going to get a lot of different answers. There's too much bleeding after birth. There are too many infections. There are not enough doctors. The clinics are too far away. There's not enough money. There's not enough education. And the list goes on and on. And everybody is right. This is all true at the same time. So when you try to solve this, it quickly becomes a completely overwhelming mix of entangled problems. Individual solutions for these problems exist, right? We know how to save these 95%. It's when you start to do it all together that it starts to feel like you're trying to solve a puzzle where the pieces keep changing shape and color and form while you're making it. And that's because all of these individual components are linked to an underlying truth. And that is that the healthcare system runs on trust. But trust is missing. And it's only when you start to build trust that the healthcare system starts to work. In our programs, we have worked with over 100,000 pregnant women and over 120 clinics in Nigeria, Kenya, Tanzania, Zanzibar, trying to figure out what trust means. And this is still a bit of an abstract concept, and I want you to leave here tonight with a tangible idea of what that means and how it changes lives. So I'm going to tell you the stories of Grace and Chris, a pregnant woman and her doctor. Grace is 24 years old, pregnant with her first baby, and her job is to work at a market where she sells vegetables and saves her hard-earned shillings to give her baby a good life. Welcome to the outskirts at Nairobi, where Grace's market stall is located. In the morning here, it smells like rain and fire. When it gets hotter as the day progresses, it just gets noisy and dusty. And Grace knows that she has to go for a pregnancy checkup at the visit, or go for a visit for her pregnancy checkup. The clinic is in the direction of that skyline, and it's not so far in kilometers, but it is far in every other sense, because if she goes, she has to close her stall. She's going to lose a day's income. She's going to have to sit at the facility and wait. And the last time she did this, they made her wait all day just to be told that the test she needed wasn't available. And then on top of that, they asked her to pay for the low-quality care she just received because there is no insurance for women like Grace. And so on this particular morning, Grace looks at that skyline, she feels her baby move, and she decides, no, I'm not going, it's not worth it. And that's a very logical decision on her part. A few days later, Grace starts to get a headache, her ankles start to swell, and she complains about this to her aunt. This is a woman who's had 5 kids already, so she knows what she's talking about, and she tells Grace, every pregnant woman gets this headache, swollen ankles, you need to rest and drink some water. Grace trusts her aunt more than she trusts the healthcare system, and that is logical because her aunt gives her sweet tea, she listens to her, she doesn't make her wait all day and then pay for low quality care. Unknowingly, Grace suffers from preeclampsia. This is a very dangerous condition in pregnancy. A few days later, she starts to have convulsions. Her body starts to move uncontrollably. No one knows what to do. Her husband, her family, her neighbors. Everyone is standing around helplessly. There is no doctor they can call. There is no ambulance that's going to come. Grace passes away in the middle of the night. She leaves behind a carefully arranged market stall, a grieving community, all from a condition that could have been managed if only it had been diagnosed. Now, on the other story side of this is Chris. Chris is Grace's doctor. He has trained for years. He has worked long shifts at a big hospital, and then he moved back home, back to his community where he knows that better care is needed. But the problem is, if patients like Grace don't come regularly, Chris doesn't have a regular income. He can't invest in quality of care. He can't make sure that the right clinicians are available at the right time. He doesn't even know if he can afford to have the tests and drugs he might need next week available. And he knows that having an ambulance in his community will save lives. And so at the end of the month, he brings his financial records, he takes it to a bank, and he gives them the book. A stern official looks at the handwritten entries and says, these numbers, they don't look good. I don't understand what's happening at your clinic. The answer is no, we are not giving you a loan. And so you start to see how everybody's keeping each other captive in this vicious cycle. It's not necessarily that there is no money, it's not necessarily that there is no care. The problem is that no one has enough trust to put their money into a broken system. Not Grace, who doesn't trust that coming to the clinic is worth it. Not Chris, who can't invest because patients like Grace don't come, not the bank who doesn't see a business case, not the insurer who sees patients like Chris or patients like Grace and doctors like Chris as a financial liability waiting to happen. But remember, 95%, 247,000 lives can be saved. And now we know that it's trust that we have to build. And you may still wonder, trust, that is still a pretty abstract term. So what does trust mean in a context like this? And we have found that the key ingredient for trust is transparency. Knowing what care was given at what time, and what quality, and what cost. With that transparency, you can enable collaboration, you can enable planned investment in quality of care, you can keep people and organizations accountable. This is going to make sure that patients like Grace start to trust the system. So 8 years ago, we set out to create transparency, and for that we used simple tools, simple mobile phones, digital technology. We created a health wallet, which is a digital place where medical information is stored so that the doctors know what care is needed and that the insurers can pay for it and also see what quality they're getting. And this changes everything. So if we go back to that story of Grace, pregnant with her first baby, still saving her money to give her baby that good life. But now something has changed. A few weeks ago, a community health volunteer came to Grace's market. This is a woman that she knows well, that she trusts just as much as her aunt. And she signed up Grace through her mobile phone with a few simple clicks for the mobile health wallet. And from that moment on, all Grace's pregnancy care is completely financially covered, and she now has a permanent connection to the healthcare system. There's a doctor she can call who knows her medical history. There's a chatbot at night who knows her medical history. And so this time, Grace knows that if she goes to the clinic, it's going to be worth it. So she grabs her mobile phone, she gets on the matatu, which is the colorful type of bus that makes up the public transport in Nairobi, and she goes to the clinic where she's seen and getting the tests that she needs. So now when the headaches start and when the swelling start, she doesn't just mention it to her aunt, she turns to her phone. She's told to come to the clinic immediately, and she's put on 2 types of medications that now are readily available. She's supported and gives birth to a premature but healthy baby girl. And this time, Grace gets to take her home. Things have changed for Chris too. Now he knows which patients are coming and when. He can plan for the right clinicians, he can plan for the right drugs to be in stock. And at the end of the month, when he opens his financial records, it's no longer that handwritten book. Because all payments are now done digitally, linked to that shared mobile health wallet. This time he doesn't have to go to a bank, he can apply for a loan online. And now insurers can see which patients are coming and when, and what good quality pregnancy care costs, and that it saves lives. So for the first time, Chris gets the loan. For the first time, his patients are insured. For the first time, Chris gets to buy the ambulance and start saving lives in the way he was trained to do. He finally can give his community the care that they deserve. So with digital technology, we created transparency. And with transparency came trust. Trust from patients like Grace, from providers like Chris, from banks, from insurers. And with trust, the vicious cycle became virtuous. Lives like those of Grace were saved. I am a mother. I'm incredibly lucky that I get to stand here and tell you that today. We have the medical knowledge to save 247,000 lives each year. And with our work, through the stories of Grace and Chris, we have shown that it is possible to bring the trust needed to get that care to where it needs to go. And yet 6 women died while I was just speaking. So let's keep doing something about that. Because the difference between life and death is trust. Thank you.